it's Jen Morgan here from Centrality Wellness. We are back with another episode of Why We Are Over It, and I'm joined by two really awesome physical therapists. So as I said, Jen Morgan here from Centrality Wellness, and I am here with my co-host Kelly, who you know. I'll pass it over to her.
Hey guys, we have a fabulous therapist here with us today, and she's going to share her story and answer our questions and just have a great conversation about Cash PT and why we love it and why our clients love it. So I'm going to let Dr. Taylor introduce herself and give us a little background, and then we'll get going. So take it away.
Yeah, so I'm Dr. Taylor Reyes, and I'm in Dallas, Texas, or just outside of Dallas, Texas. And I specialize in pelvic floor physical therapy, but I'm also a certified functional manual therapist. So I do a lot of holistic, like most physical therapists. So I joke that I specialize in treating a little bit of everything, like we all do, right? So I graduated from Hardin-Simmons University in Abilene, Texas in 2014, and then I started working in an outpatient clinic in Richardson, Texas right after that, and I was there for about 3 years and working on my certification, and then I got pregnant, and then that's kind of the catalyst to the cash practice.
Cool. That's amazing. So I'm actually not familiar with a certified functional manual therapist. Can you just give me a little bit of background, like what that is?
Yeah, so it's a manual therapy certification, or you don't even have to get certified. It's just the Institute of Physical Art is a continuing education institute. So you can do all of the courses, which are very, I would say, osteopathic based. So it looks at a lot of mechanical, like visceral, neurovascular, that like treating from that lens, as well as a lot of proprioceptive neuromuscular facilitation and movement strategies and things like that. So you can choose to get certified, which just involves taking all the core classes and some electives, and then doing this week-long certification in Steamboat Springs, Colorado, which is a beautiful place to be really stressed. So yeah, so you can kind of do it at your own pace. It took me I started taking the courses while I was in PT school. So 2 years after being out of school, I got certified. So
wow,
I was ready to get it done. So
yeah,
that's amazing. So I'm training under Baral for visceral. So I've taken their all visceral coursework, like 1 through 5, and then I've taken some of their neural stuff. So similar lenses, it kind of sounds like, or at least a little bit.
Yes, super complementary. And I think the visceral, the VFM, visceral functional mobilization, the course through the IPA is very Baral-y, yeah.
So what drove you to choose cash, right? I mean, you could have left your clinic and decided, I'm going to start my own place and I'm going to take insurance, or I'm going to contract with Medicare. Like, what made you decide to go more cash-based?
Well, I kind of did it on accident. Like, it wasn't really, I wasn't ever really planning on starting like a clinic that could actually be an actual source of income or a career. It was just, I just didn't, I got pregnant, and I didn't, which wasn't really in our timeline. And I was like, well, I don't want to be pumping in a private treatment room. That's just not, I just didn't see myself being able to work, full time and also be a mom, like, cause I just didn't know how it was going to go. So, I thought, well, instead of treating all my friends for free that I do even on the weekends, why don't we just make it legit? And I, formulated the LLC while I was about 7 months pregnant. And I thought, well, I'll just, treat some people on the side, just to kind of keep my skills up. And then I saw how it actually worked out really well. And it just kind of turned into a cash prize. Like, it just turned into its own functional thing. And, I would have never done, even if I had decided on purpose to start my own practice, it would have never been insurance based. Just because the main reason is the lack of transparency, I think, that most patients have when walking into the physical therapy clinic. Like, they have no idea. Like, they think, if anything, they're just paying their copay. Like, even if they have their benefits verified and explained, it's still not clear what they're going to be paying at the end of the day, 3 months later. And so time after time, I'd have these patients, they'd come in very distraught, not with me because they know it's not the therapist's fault, but saying, why did I just get a bill for $1,200 or whatever, when they thought they were just paying, a $20 copay each time they came in. And then especially if they're relatively healthy people, and if they have really high deductibles, like they're not even going to meet their deductible. So it's like, okay, well, instead of playing that game and being delegated by the insurance company that doesn't know the patient, doesn't know me, doesn't care about our goals, and they're just looking at numbers, why don't we just create this environment where we can do what we want? Because I don't like being told what to do anyway. you know so it's like, and then that way it's very transparent. They know what they're getting into, and they see the product, they get the product, they paid for the product, and if they really want to seek out reimbursement, then it's their choice.
Yeah. I love that. I love bringing up the piece about transparency, because so many times you're absolutely right. Patients have no clue, and it's 3 months easily can go by and get that bill, and everyone's frustrated. So, yeah, totally agree with that.
Yeah.
So, buy-in. Are there a lot of cash-based practices around you, and how do you get clients to come to you when we're so used to an insurance-based system?
Sure. So, my whole setup, my practice, fire physical therapy, is a little different. I work 2 days a week out of my house, which is really nice. We're just in my office here at my home, and so a lot of the clientele that I end up getting is word of mouth, which is really helpful, because you don't really have to convince people when they've already heard what they're looking. They've already been warned that there's no insurance accepted, and so I don't really. A lot of times, I'm not really fighting that battle or having to have those conversations. But when we do, just really, breaking it down to them, like, hey, this is what you'd be looking at in going to insurance. And I even give them the name of, like, the clinic I used to work at, because it's not very far, and a couple other clinics. Like, hey, you can call them and see what you're going to be paying, see what it's going to look like. Your visits are going to be maybe 15 to 30 minutes if you're lucky, one-on-one with a PT, and then it's going to take, you're probably looking at like 10 to 12 visits just on average, because it's more of a systematic thing, with a template approach versus a customized one-on-one. So it's like, this is option A, and then this is what it would look like if we did it. You're paying this much for an hour, and we're estimating 4 to 6 sessions, because we can spend more time and give a lot more intentional care, which, the FIRE in fire physical therapy stands for functional, intentional, restorative, and empowered. And the idea is that we focus on those 4 pillars with each visit, so that we're not just spinning anybody's wheels. So in regards to buy-in, there's been a couple times where people, they'll talk and they'll schedule, and then they'll say, I just can't do it, it's too much. And I totally understand that, and it's not my job to convince them. So if they either they find a solution, or they'll eventually want to, eventually it'll be worth it to them financially. And then, as far as I've also had a couple patients, they'll do a visit or two, and it's just like, hey, I just can't financially afford this. Which, if you don't have the money, you don't have the money. Like, whether you have insurance or not, like, some people can't afford even a $40 copay. So that's when I just do my best to say, well, hey, here's an arsenal of stuff to just work on, and you know what the costs are, and you can always save for it later down the road. So. But it's also not my job to micromanage their budget either. So.
Yeah, and that really also empowers the patient to advocate for their needs and to prioritize in their own life, right, before they actually step foot into the room with you. Do a lot of your clients ask for super bills? Is that like something that's like big? It seems to be pretty regional. It's kind of what we're seeing, that some areas are more into super bills and giving those to their clients, compared to others who are like, no, my clients don't even ask.
Yeah. So they don't really ask. A few of them do. I think out of the 2.5 years that I've been practice, I've had maybe 8 people actually ask about it, and then maybe 4 people actually follow through and submitting them, and then actually coming back to me and saying, hey, this is what I was reimbursed, or actually having feedback from them. So I do provide the EMR that I use PT Everywhere. Are you familiar with it?
Mm-hmm. Yes, that's what I use.
Yes. So it's I love it. And so, you can just, it's super easy when you do the note. You just, the super reel is just automated, and then it's there for them to download, which the first 6 months I was using a very pen and paper system, not even EMR, because it wasn't electronic. And that was a huge pain, trying to write up the super bills. And I'm like, we need to make this automated. So because when they do, and it's 6 months later, and that's another thing I see people, that they aren't really interested in the super bill in the moment. It's several months after, when they're kind of going through everything. And
yeah,
very cool.
Mm-hmm.
Do you see, or do you have clients who are falling in that Medicare population reaching out to you to be seen in your area, or no?
Yes and no. The people that kind of refer towards me, they know that I don't take Medicare, because I don't know about y'all. In Texas, it's so gray. It's way too gray to even I don't have an admin assistant. It's just me. It's just me, and I have a 2-year-old. So I'm like, I don't even have the bandwidth to try to find a way to make that work, but it's too gray for me. I feel too risky even entering into that, especially because 90% of what I do is manual. So there's no real easy way to say, oh, well, this is just a wellness session, because that's not what I do. That's just not my product. So there are some people who do want Medicare patients that do want to be seen, but then I just have that conversation and say, hey, here are some other options, some great clinics that do accept Medicare, so that they're not just left without any resources.
Mm-hmm. Great.
Yeah.
Good.
Totally. Kelly, is Indiana pretty gray too? I don't think have I asked you? I'm not sure. Is Indiana pretty gray?
Hey, yeah, so I'm in Indiana, and I just feel like it's gray everywhere.
Yeah.
A lot of people we've talked to, it's kind of the same thing. Either you fall into, if people have the business model to offer those wellness services, they will see clients who have Medicare, but it's really, really gray. Like you said.
And I even called Medicare, and they couldn't answer the question. So I'm like, I don't want to go to jail. I don't know, not that I would, but it's like that one instance. It's like, okay, you have insurance fraud, now you're going to jail. I'm like, that would happen to me, So I'm just like, it's just
not a risk you're willing to take.
We won't even talk about anxiety.
So in your schooling, did you guys talk about cash PT or business, or did you have any clue that cash PT, that was a legit model for physical therapists?
No, absolutely not. That was in school, and in school, we did have a class. It was a semester where we were supposed to develop our own practice, and go through you make your own logo, X, Y, and Z. You look at the demographics and figure out how much you should be charging per unit. Really thorough. So yeah. If I wanted to do an insurance, I feel like if I'd wanted to do an insurance-based clinic, that would have been a helpful exercise to do. But at that time, I was like, I'm never owning my own clinic. This is the second time I'm doing this. What the heck? So I feel like, it was that one semester, that one class, that one semester, the same semester we're studying for our boards. So, it's not like it's a top priority. I feel like that professor did do a good job of making us very realistic, illustrating very realistic expectations of what goes into. But as far as actual practice, in clinicals, I don't know about you, it was supposed to be in our checkoffs to talk about management and people and processing. And I think whoever checked those boxes were like, meh, I run people. I'm the boss. And that was like the conversation. You know, I mean, it was just like not even, so no, a long way to answer your question.
No, I'm always interested to hear what people learn about in school. And I would say like what your experience was is similar to mine, at least, as far as, okay, you have one class. And I mean, I didn't even know cash PT was a thing until not even that long ago. And I just opened my clinic at the beginning of June. So it's like, it's not this, not really well known, but if you look, you can find lots of people that are out there doing it and really great support systems. So,
yeah. Well, and I did, Danny Matei?
Mhm.
I did his mastermind group for a year. And
okay.
that was great. And then, Lauren Smith-Sock and Carrie Pagliano, they run the PT Mompreneurs group. And we started the first cohort last fall, a 6-month group for mompreneurs. You don't have to be a mom, but anyone kind of with that same lifestyle goal. And we went through the first group of ladies, and it was super awesome. But with the COVID stuff, we kind of put that on pause. So we're starting up our next group in the fall, tentatively.
Fun!
Nice.
That's so exciting.
Yeah, which is really nice because I super love the mastermind group I was in, and I would do it all over again. But also sitting there when a lot of your peers are single men with like 1,000 times 10 amount of time to execute their goals, and I'm like, I have to do the laundry. I'm like, I have to cook and I have to do the laundry, and my daughter wakes up at 5 and goes to bed. It's like, no, I'm still trying to execute goals from 3 months ago, and they're already like 6 months ahead. So being surrounded by peers with the same struggles, it just, because it's easy to feel I'm not doing the best job I could be doing, or I'm slacking. It's like, no, you have a child, you're fine. So
I love that.
yeah, so I love both groups. I think they're both very, very valuable.
Totally. Did you happen to get pelvic PT information in your schooling? Like, I just felt lucky that I actually had some of that. Cash PT I knew nothing about, but like I know pelvic is also not a common thing.
We had one lecture.
Oh, yeah.
One lecture.
Same
And
here.
it was the a pelvic floor specialist. She was certified through APTA, the CAP pelvic floor PH and OB. She came in and did like a 2-hour lecture, and we talked about the Laycock assessment. And that's all I even remember from the course. Like, what is women's health PT? This is an intravaginal exam. And it wasn't even like it was just like, oh, pelvic floor PT means female.
Yeah.
Vagina. Like that, that's what it equated. And it's like, no, like everyone can benefit from pelvic floor PT. So it wasn't until my clinicals, and then also the IPA, their lower quadrant classes are very heavy on pelvis. It's not they do have a continence, reproduction, and sex course that's very, very good, and I'd highly recommend it. But you kind of walk away like not purposely, you become like a pelvic specialist just from taking their courses because it's so heavily integrated. So not necessarily with like intravaginal exams, but we do discuss like intrarectal exams for coccyx dysfunction and dysfunction and things like that. So very thorough.
Nice.
Love that. Super cool. I don't think we've actually come across anyone who's talked a lot about like IPA coursework. I'm familiar with IPA. They're on my list of things to take. And it's really cool to hear about like all of the different things that you have done or that you're very familiar with, because that's definitely like, oh yeah, I'm on the right track, because this all sounds like things I'm really interested in, especially because Kelly and I are both pelvic health physical therapists too. So I'm kind of like, oh, that sounds great.
Yeah, I'm very like, I kind of don't know where I'd be without the skills that I picked up through that program. So I'm really thankful for that education. But I'm also really excited to learn more and other,
Mhm.
from other institutes as well.
Totally. So, did you get any other information about Cash PT from anybody? Like, did you research? Like, yes, you said Danny Matea, or Matei, right?
Mhm.
Did you read any books? Did you like look up Jared Carter, who's like this Medicare trying to make it black and white? Like, who did you like follow?
Yeah. So in my clinical, my longest clinical, my mentor, my CI was also a CFMT, and he was in a hybrid cash practice. So he was actually working with a functional medicine doctor, and she had a contract with Medicare, so they did see Medicare patients, but I think they only took Medicare and Blue Cross and United, so everything else was cash. So that kind of opened the door to like, but even then it was like only $100 a session.
Wow.
So it's like, that's not super sustainable. But now he's evolved, that person has evolved, and it's just completely independent, and it's, it's no insurance at all. So it's much more sustainable that way. I think, well, I don't know. I know some people have some very successful hybrid practices.
Yeah.
Absolutely.
So that I didn't, other than that, just being exposed to it, and then again my accidental development of my practice, and just the concept of like, I don't want to have to report to anybody except myself and my child. So I guess
love
my
that.
husband too. But yeah, so it just happened. But I just listened to a lot of podcasts.
Okay.
Yeah.
And your fans?
Danny's podcast, pretty much.
Right?
Yeah. Yeah. It's funny. I actually kind of accidentally signed up for the mastermind too. I wasn't planning on doing it. I was very naive, not naive, but he had this thing out, like, if you want like a free 45-minute phone call to just learn about what you should be pricing yourself, et cetera, et cetera. I was like, well, that sounds great. And he seems like a friendly guy. So I like signed up for a call, and he's like, do you want to sign up for the mastermind? I'm like, what's the mastermind? So, and then I joined.
Yeah. That's awesome.
It was worth it. It totally came out in the end that you learned, and it was great.
Yeah.
Yeah.
I thought he was just doing it out of the kindness of his heart. I'm like, oh no, that doesn't happen. So
It worked though. His marketing worked.
Yeah. Yeah.
Yeah. Yeah. So that's
Good. I love it. That's so awesome. Okay, so we always ask, if you had to give one clinical pearl, one like golden nugget piece of advice, either for physical therapists or for clients that are thinking about, or they're in the Cash PT realm, what would that be? What's your clinical pearl?
for someone starting a cash practice, pretty much.
Sure. Yeah.
Don't take the mentality that, hey, I'm going to set my rates low and then raise them later, because that just puts, unless you like don't have a heart. No, I'm just kidding. Like, it can put you in a really tough, an awkward situation when you do decide to raise your rates. So like, and I say this from personal experience, I started off, and just to be transparent with what my rates are, I started off doing, what was it? 120 for evals, and then 100 for follow-ups. And even then, I just would die a little bit on the inside. Like, oh, I feel like this is so expensive, and this isn't fair. Everyone should get PT, and it'd be affordable. And it's like, but then I would take insurance. And yeah. So, and then not long after that, I got into the mastermind group and was advised to raise my rates to like 185 for single sessions, and then do package visits. And I mean, I'm sure y'all are very familiar with most insurance or cash-based rates. And so that's a really far jump. And once you really realize that you're worth, that, you have to really realize this is a product, this is your time, you're very educated, you don't owe anybody anything, right? Like, you just need to, right off the bat, like, shoot high. And then I think some really, really great advice that I got was set your rates, and if 6 people in a row say no, then you know to lower them. Right. If they all say no, then you need to lower them. But and the thing is, it's funny. Like, when I would say, oh, hi, can you want to schedule a visit? It's going to be 100, 120 for the first visit, and then 100 for follow-ups. And people would be like, I don't know, that's kind of expensive. And then even throughout treatment, I feel like people almost treated me more like a massage therapist, because that's kind of the same rates of massage. Not that there's anything wrong with that, but it's just a different, there's a certain level of compliance that has to go into your rehab component. And so, as soon as I switched to those higher rates of 185 and then the package rates and things like that, I would tell my rates, like, okay, sure, but like, no problem. Like, it was just immediately they associated with the quality of care with the price. And then the compliance and follow through was so much better with my patients. And so they even got better faster, which is like one of the whole points of doing cash PT, is it helps people get better faster in an ideal situation. So this, that whole time thinking I was helping people out by lowering my rates, and would one day get the courage to raise them, it was really just hurting everybody in the end. So just really, so the abbreviated version of all that is pick your rates, set them where and this is another piece of advice I heard, set them where they make you a little uncomfortable, and then go from there. And if you can't get any business, then you can drop them down a little bit. Because that sets the tone. It sets the tone for yourself, and it sets the tone for your clients. And then you don't want to have to be in this really awkward situation where you're like, well, I've raised my prices quite a bit. They're very used to.
Yeah.
Much. So.
Totally.
That's great. I love that. Great advice. Love it.
What about for someone who is considering going to a cash-based therapist versus like a traditional model? So they're kind of teetering on the fence, like, should I go try a physical therapist at the clinic down the street that I've been to and I've tried, or should I make the jump and invest in my health? Like, which obviously you can tell I'm biased by my phrasing, but like, right? What would you say to that client?
Well, so if they were trying to go to what they already knew versus try something new, we'll ask them what their experience was. Like, what was it about your, the insurance-based practice that you really loved, and can I offer that to you? Like, can I offer you that plus more? Right. And just really delineate. And sometimes I just have to walk people through. I'm like, especially if they haven't been to an insurance-based model, I have to say, hey, you're going to walk in, you're just, someone's going to open the door. Mr. Smith, okay, you can come on back now. Here, have a seat in this really open gym with tons of people staring at you, and somebody watching TV while they're doing the arm bike, and and someone's pulling on some rubber bands with like improper form. And then he's like, okay, how can I help you? Well, this is hurting. Okay, well, let's start you off with some heat and some ice. Like, I kind of walk them through. Not all practices are like that, obviously, but I'm preaching to the choir. I just walk them through that common scenario, and then the rest speaks for itself.
Totally.
Love that.
So you are in Texas, just outside of Dallas.
If
someone in that area has questions or is like, oh, I totally want to work with Dr. Taylor, how would they find you? What is like your Instagram, website? Like, what are your best platforms to find you on?
Yeah, so my website is just firephysicaltherapy.com. They can see more information just about kind of how I'm set up and the things that I offer. I'm very active on Instagram, and my handle is Your Lovely Pelvis. And then Facebook is Fire Physical Therapy. They can also email me. It's taylor@firephysicaltherapy.com. So
cool.
I'm not on TikTok yet.
That's okay.
I'm still trying to
Jen is new to TikTok. I am not on TikTok either, but Jen has been dipping her toes in that platform.
2 days. I've only been on TikTok for 2 days. Let's not think that it's a thing. I'm like terrible at it. If you like TikTok, there are lots of other people to follow. It's very
Yeah.
cool. Well, Dr. Taylor, this has been amazing. I am super, super, super happy that you were able to join us. Thank you.
Thank you for having me. This is great.
I know, I just made sure I followed you. So if you don't follow Dr. Taylor, go do it.
Oh, okay.
She's got good stuff.